Welcome to the Vital Living Forum and this recognition of Black culture and lifestyle. Today we're discussing health disparities among Black Americans, and we'll discuss common health concerns, the reasons why some health conditions are more common among Black people, and how you can advocate for the care you need and deserve. Joining me are Dr. Nicole Crawford with Keep Moving Forward Consulting, also Dr. Fabian Garcia with MedHealth Clinical, and Coach Arnitra with Butterfly Transformation Nutrition Coaching. Welcome to you all.
Thank you.
Dr. Garcia, I want to start with you. What are the main concerns that African Americans really need to focus on, or that are common issues that we should be focusing on with our health?
That's a very good question, and I think it's particularly relevant in today's society, right? We're in this internet age, we're in the age of Instagram, we're in the age of Facebook, right? So everyone's giving you some sort of advice. You know, you need to be using selenium, you need to be using chromium, you need to be using, so what's really important? What do we need to focus on, right? And so what I try to tell my people is we need to focus on and all of those things have merit, right? But we need to focus on the fundamentals first, right? We need to master the fundamentals first before we're going to start going and branching off into these other nuanced things, right? So, bottom line is blood pressure, right? We need to be focused on our blood pressure. I need my patients to know their blood pressure, right? I have a little story. My dad tells me recently, I'm his doctor, by the way, and he says, son, my blood pressure is 170 over 100 recently. Yeah, exactly. And I said, well, check it again now, and so he checks it again, and yeah, it's still 170 over 98. And he says, you know what? I'm just going to stop taking it because I feel fine, right? And so I know if that's happening in my house, that's happening in other houses, right? So, but you can't do that, right? You have to be paying attention to your blood pressure, because that's the first step that leads you to atherosclerosis, right? Atherosclerosis, that's heart attack and stroke. That's the first step that leads you down the path to chronic kidney disease. What's chronic kidney disease? Does anyone know anybody on dialysis? Chronic kidney disease when it goes haywire, right? And I understand my dad, because he doesn't want to be on medication, right? And so, I just try to tell him, listen, we'll do the medication thing for now. Let's work on the risk factors, and let's work on the problem. We don't want to live on medicines, but we can be on them and then get off of them, right? Secondly, and I don't mean to be long-winded, if I am, just shut me down. Diabetes, right? Know your A1C, family. If you know your A1C, then at least you're engaged in how to start to fix the problem. You can't fix the problem unless you have defined the problem, right? So A1C is super important. And then just quickly, and interesting for this demographic is, 80% of Black people are vitamin D deficient. 80%. That's 8 in 10. That's several. And so who cares, right? Well, vitamin D deficiency, that's something that's going to lead you to high blood pressure. Vitamin D deficiency is going to lead you to sugar problems. That's diabetes. Vitamin D deficiency leads you to cancer problems, right? So has anyone ever heard of those 3 problems, right, in the Black community? That affects, so get your vitamin D. You need D.
Absolutely. And both of you are in the same field. What do you think are major concerns and it can be the big picture. Dr. Garcia was really specific. It could be the big picture. What do we need to focus on with our health?
When I hear health, I think all aspects of health. It's not just your physical health, it's your mental health. And I would be remiss as a therapist, as a social worker, if I didn't make that mind-body connection. When your blood pressure is high, you have certain feelings in your body. When you have cancer, when you have any physical ailment, that can lead to something that affects your mental health. So I think we need to make sure we focus on the 2 of those things combined, because they're very much connected.
Absolutely.
The other aspect of that is when you think about high blood pressure, diabetes, high cholesterol, so many of you often just think about the food you eat, but it's the lifestyle that you lead fully. I'll give examples. Oftentimes you may say, oh, I have diabetes, I'm gonna watch my sugar. What does that really mean? But we still drink alcohol, we still don't move around, we still don't exercise. Those are the things that are actually going to help you improve. And for some of you who don't take any meds, that's how you're never going to get on them. But for those of you who are already taking meds, at some point you may want to get off of them. And so it requires you to eat differently, and eating differently doesn't mean no fun, no frill. But it does mean, how do you make a more balanced plate so that you still enjoy your food, but it is supporting your life? And then your lifestyle, we gotta still get up and move. Many people in the Black community, I always do in any conference, I always give a visual of a healthy older person. And oftentimes people do not imagine individuals who are non-white. We give a full visual, riding a bike, you're 70, you're out skating, you're swimming, you're with your grandchildren. And if I show pictures, the picture of the family or the couple is not people who are brown, because they don't necessarily see older brown people as healthy. So I always say we got to change that narrative, but it starts with you, and it starts with you being able to live the full life and not just the piece that you choose. So we got to exercise, we got to get up, we got to move around, and we got to eat different. Okay.
I had a chance to read, the National Institutes of Health did a state of Black American health, and it reads like a horror story, mostly because there was one word that was repeated throughout the report, and that word was preventable, that we die of preventable deaths. And our health outcomes are among the worst of any other demographic. What's behind these health outcomes that we get prostate or breast cancer, it's more deadly than it is for our demographic counterparts. What's behind those numbers, those outcomes?
So I'll answer that by saying this, right? So we know that African Americans they suffer disproportionately with cancer. We know they suffer disproportionately with renal disease, kidney disease. We know they suffer disproportionately with heart disease, right? But let me ask you this. Do Africans from Africa suffer with disproportionate cancer? They do not. Do Africans from Africa suffer from more renal disease? They do not. And do they suffer from heart attack and stroke more often? They don't. So the point of what I'm trying to say is it's not a genetic problem, right? The genes are good. It's an environmental problem. It's not, you're not getting it because you're African, you're getting it because you're in America. It's the American, lifestyle, I think. And modifiable, to your point, modifiable.
I would say for sure, when you think about the culture of brown people, and since we're going to talk about African Americans specifically, stress. The impact of stress to a body is more significant than people would like to realize. When you are someone who works shift work, if you're someone who is constantly ignoring how you feel because I have to raise the children, I have to go to work, I have to take care of my parents. So you ignore the signs of your body, and stress is taking a hold on you. So that is the number one issue that is disproportionate, which is the level of stress, but also what do you do about it? Usually nothing. We ignore the headaches. You ignore the lack of sleep. And so women are becoming a lot more vulnerable, right, to heart attacks, stroke, cancer, stress, fibroids, stress. There's so many things that are just pushing you in the wrong direction. The CDC shared in 2021 that the only way that you will be able to potentially fight cancer is your lifestyle. Many of you, when you were younger, cancer was a thing people got, and it had nothing to do with the life you lived. But now it is 100% really more about some of your lifestyle choices. But some people clearly will still get cancer, but your lifestyle choices are going to be the thing that helps you most. And so you have to be able to manage stress, sleep, activity. But those are things that most people in our community will ignore.
And you have to think about the environment. Social determinants of health, in a lot of research that is done, look at our environments. Do you have walkable streets? Mm-hmm. Are there places that are safe for you to go out? Is your park clean? Is it safe? So thinking about our environment, the economics, and all of the things that are external that we have some control over. Can we go out with a group and walk at a certain time? Can we go someplace else? Can we do things that will stimulate our minds and our bodies to be able to sustain and deal with those levels of stress that we have?
One of the things that Coach Arnitra brought up, Dr. Crawford, was the mental health component to it, and really we don't, as a community, take advantage of the resources that are there. Why is mental health such a taboo in the Black community?
I'm crazy. I'm not well because of mental health is one of those things that has been a secret for a very long time. It's starting to be one of those things that people talk about. I have more African American clients than I've ever had before. The majority have always been of any other culture. And I think what we have to think about is it is our imperative to ask for help. We cannot live this life alone, and our mental health is imperative for us to be able to do the things that we do on a daily basis. If we're getting up and we're not feeling right, if we're getting up and we're like, you know what, I can't handle this day, we need to talk to somebody about that. And sure, pray about it, talk to a friend about it, but sometimes those people can't give you what you need to get to that next step. So that's why there are therapists. Yes, access is a huge issue. Access is one of the main issues why some people don't go into therapy, but being able just to talk to somebody else who can give you a different perspective. Therapy doesn't have to be lifelong. Therapy can be brief. There are programs that we run, behavioral activation is one of them, that are brief. We can do interventions that might be 9 weeks long. And we just need to be able to step outside of the mindset that going to a therapist means we're crazy. It doesn't. It just means we're doing something different to benefit ourselves.
And we are going to continue this conversation. Thank you very much, Dr. Crawford, Dr. Garcia, and Coach Anitra for that information. And when we do come back, we're going to dive deeper into the health concerns facing our community and how we can all work toward a healthier version of ourselves. We'll be right back. Welcome back to the Vital Living Forum and this recognition of Black culture and lifestyle. We're going to discuss the role nutrition plays in reversing negative health trends in our community. And joining me again are Dr. Nicole Crawford, Dr. Fabian Garcia, and Coach Arnitra. Welcome back to all three of you, and we're doing a great job. I want to start out by talking about the relationship that our health and food have. As much as a lot of people try to disconnect the two, it is real, and we need to focus more on nutrition. So let's talk about why nutrition is important and how it plays a role in our overall well-being. We'll start with the doctor.
Okay, sure. So not only is it real, it's central, right? And so I like to tell my patients, there's diabetes, there's high blood pressure, there's high cholesterol and obesity, right? And those seem like 4 different problems, but they're actually the same problem, and they're all related to your consumption of food. They're all related to processed carbohydrates. And so just trying to get my patients to understand and make that connection, that can make all the difference in the world. If you can just make a simple, you don't have to be, like she said, no fun, no frills, right? But you have to be strategic and you have to be intentional with what you're doing. And yeah, food is central.
So I get a chance to coach people every single day on the food they eat. And oftentimes in our brown communities, you think that the cultural implication of changing your diet means that you've left behind your culture. And it's very difficult for people to make the transition because you feel like you're going to take away things that you know. But the point of good nutrition is not about taking away things you know, but it's understanding how to do it a little bit different so that you can help yourself. When we see things happen in families, that we always say it's genetic. No, what it is we see habits. Mm-hmm. What we see through families are habits of family members that have not changed. So once you get a chance to get more balanced, have the right amount of protein, have the right amount of carbohydrates, when we can stop individuals from chronic dieting and binge eating, you find that their health is a lot more balanced and they don't have as many concerns. But you have to be okay saying, I do need to do it different. It's okay to not have bacon. It's okay to not have sausage. There's other options. It's okay not to eat grits every day, right? It just happened to me yesterday. It just happened. It's okay to do those things. It's okay to say that I don't need to drink coffee every day. It's nothing wrong with any of these things. So you just have to understand that you have to make a choice and a decision to want to make improvements, and then you'll find that many of these health concerns go out of the window.
And Dr. Crawford, I have a friend who shares your academic credentials and who says to me, I just can't. I can't. That represents my mama, my family. I can't change my diet. I know what it's doing to me, but I just can't because I'm connected to this food. It means love to me. It's my family to me. How do you get over barriers like that?
We have to start by teaching people about the gut-mind connection, because there is a gut-mind connection. I know what happens to me when I eat bread, when I eat a lot of bread. I love bread. But I know what happens to me when I'm eating it every day. And so teaching people, but giving them the space to be able to process that learning and looking at what motivates you. Are you motivated to be healthier because of your own needs or because of someone else's? What is it that is your goal? And in giving people space to be able to say, you cannot let the love go if you change, like Coach Arnitra said. We don't have to separate the two, but we have to understand that you being here means more to your family than what you eat every day. So let's change the mindset about why we're doing what we're doing and give people the motivation to continue doing it. I understand what it does for me, so I don't eat it every day. I'm still gonna have my fun. I will bake my coconut bread, which is cultural for me, but I'm not gonna bake my coconut bread every other week. It'll be on a holiday. It'll be for something special.
So what do we do when it comes to reversing these trends? How do we make a decision, get help, whatever we have to do to start down the road of changing the trajectory of where we're headed? How do we begin?
I think this is kind of, I wish this room was full of doctors right now, because I think a lot of it has to do with the fact that, our medical professionals they're not teaching anymore. The modern doctor's a drug dealer. He's got 15 minutes, he's got to go. And so I think the reason why it's not happening, at least from my perspective or from my field's perspective, is I really don't think doctors know how to reverse disease. I think they only know how to prescribe, because that's where their training comes from. It takes some extra effort to be able to know how to reverse it, But the point is, it can be reversed. Don't doubt it. Whatever your problem is, generally speaking, can improve. And so you can come off medications, but you just need someone to coach you on how to do it, hold your hand.
We need to think about, our country doesn't come from a preventative standpoint. We are all about fixing what is broken. But if we start thinking about, what can I do to not let this happen? Or what can I do to not let this happen again? And we also have to think about being our own advocate. We know ourselves better than anyone else does. You listen to your body and you do something different. If that doctor is not listening to you and giving you the amount of time that you need, find someone else. You do not have to stay there. You don't have to stay there. They work for you. You're 100% correct.
So often, though, most people know that they need to do it different. But when it comes down to being action-oriented, most people, unfortunately, are not going to take the step. We go to the doctor says, do this. There's a couple things that can happen. You can be afraid, and you don't want to do because of fear, or you just don't know what to do, and the doctor doesn't know how to tell you what to do. So you have to actually ask for help, and that means you have to take the step to actually take action. But oftentimes then, once we do take action, people do too much at one time. They try to go from 0 to 100. But it's not sustainable for you yet, because you have to change your mind, and that takes a long time. So you need to take baby steps. You want to challenge yourself, but you need to take steps that you can actually execute. Do a little bit at a time. And as you feel better and you're more confident, let's do a little bit more. And you keep pushing. And that is how people can create the habit and a stick. Versus you think you can do so much, you'll never stick.
Right. And then we just need to, sometimes we set these goals that are so broad. It's about maybe taking a step back, doing something specific, measurable, attainable, realistic, and time-oriented. That's the SMART goal method. What can I do today for 20 minutes during my lunch break in order to get my heart pumping? So being specific, and then having somebody who's a trusted advocate, who's a trusted friend to help you be accountable. That's how those small steps become bigger steps.
You know, one of the important things that we don't have is, I think, as a community, we lack a whole lot of health literacy. We don't understand a large part of how these things are all connected, understanding the language that even sometimes our doctor says something to us and we don't know what it means, but we don't ask, what does that mean? And you know, can you break it down for me? So how do we increase health literacy among our community to help these outcomes, improve the outcomes?
Go ahead.
I think our first step should be for people like us to sit with people like this audience and have a conversation about what is it that you don't understand? Because a lot of times people don't know what they don't know, and they don't know what questions to ask. So I've been to doctor's appointments with some of my friends' parents. I've been with my own family. Find somebody who can be that support for you and maybe break down some of those words. And if you're that person, be it for somebody else. It starts with our community being able to connect with one another and help one another. And we also, as academics and practitioners, have to learn to meet people where they are and not try to talk in words that are way above anyone else's thinking. And we're taught a certain way, but that is not how everyone else speaks on a daily basis. So being human and meeting people where they are is one of the ways we can start.
Yeah. The other aspect is once you know what you need to do, and most people do, as I said, most people do know what they need to do. It's actually using the resources that you have, because so many resources are free, but often we don't use them until we need to use them. I always say you got to do it when it's still fun, because when the rubber has hit the road and now there's something wrong, it's not fun to have to go find the information. So step one, you have to actually take the free information and do something with it. Number two, feeling comfortable to challenge and talk to a doctor. It is very difficult when somebody has walked away to now figure out, well, what happened? What do I do if you didn't ask the question? And in certain age ranges, it is inappropriate in somebody's mind to stop the doctor and say, hey, can you explain that? What are you talking about? Now, do I feel like maybe somebody shouldn't have to do that? Sure do. I think a doctor should be able to do that up front, but oftentimes that's not the case. So you gotta feel comfortable saying, hey, I don't understand what you're saying. Can you please, let's go over that again? Because I consult people every single day, and I see it every day that people walk out and have no idea what their metrics mean. They just got some lab work handed to them. They have no idea, and so they don't understand the alarmingness, or either that was just small. Right. They don't have the gravity of what is really happening. So those are two things that you can do every single day. And then the last one is truly making that choice around, I deserve better and I want more for me, and I'm gonna kind of go after it a little bit so that you don't have to feel like you waited until it was too late.
Well, we are not done. We've got more coming up. Dr. Crawford, Dr. Garcia, and Coach Arnitra, this has been a great discussion, but there is more. And when we do come back, we're gonna discuss how to be an advocate, as Coach Arnitra was saying, for your own health. Stay with us, we'll be right back. We have a question from our audience. Let's go to you.
Thank you very much, panelists. It's been very informative. But Dr. Crawford, I believe, in reference to the mental health aspect in the African American community, you mentioned about the taboo. How do you break the taboo? That's my first part. And the second one, you spoke about accessibility. How does it become more accessible to us? I'm the senior advocate for my church, and we have a lot of seniors because of COVID who've been socially isolated, and I see more of the mental health aspect, including in my own family. How does that help become more accessible to that community?
Great questions. As far as the taboo and breaking down the stigma, we need to have more conversations about what it means to be mentally well. We talk about mental health, but mental wellness is mental health. It's a spectrum. People talk about mental illness. That's when you have some type of diagnosis or disorder. And people move in and out of those spaces. If anyone's known anyone that's been depressed before, they may not be depressed now. But having those conversations in the open, in more settings like churches, if you have a senior group or if you have a health group as part of your church, invite somebody to come and talk about it. That's how you create more access. There are people like me who are willing to come into the community, be that support, but also one thing I want us to think about is being a part of research. I currently work at the University of South Florida, and we have a mental health program that we're working on right now on a grant. There are research programs that are out there that can be a part of your community and offer some of those things. So I know there's a huge barriers to us working with researchers. I understand the historical significance of it, but at the same time, if we're not a part of it, they will never know how it affects us. There's too much research that's out there about everybody else. So we need to open the doors for that. And we also need to look at what providers are in our community that could be, maybe do a support group. You know, we don't, yes, my name is I have a doctor credential, but I know that sometimes getting paid is not the goal. The goal is to make sure the people in the community are healthy.
And we have another question from our audience.
Thanks. You have been very informative, and you have presented the information that we can all assimilate. I want to say thanks to you all again, Dr. Garcia. It is noteworthy to hear a doctor mention a nutrient. Many doctors just prescribe the pharmaceutical, but when it comes to nutrition or supplement, no mention is made. Having said that, Dr. Garcia, how much vitamin D would you recommend? Would you recommend that be taken?
So with vitamin D, you kind of gotta be careful, right? Yeah. Because you can overshoot, and I've seen it happen before. So I mean, I think a nice, safe, if you know, without having any information on your baseline levels, 5,000 IUs a day, and then I also like it to be taken with vitamin K2, which a lot of people aren't aware of what K2 is. So in a nutshell, vitamin D is telling your body to hold on to calcium, right? But in the absence of K2, D can go anywhere. Calcium can go anywhere. It can go to your vessels, you can go to muscle tissue. You want it to go to the bone, right? So K2 is like the traffic cop that says, take it to the bone, which is what, you know, the aging population with osteoporosis and these kinds of things, that's where you want it. So 5,000 with K2. Thanks. Yes, ma'am.
Well, thank you all for your questions, and we'll be right back with more. Welcome back to the Vital Living Forum and this recognition of Black culture and lifestyle. We are going to focus now on being your own health advocate. We still have Dr. Crawford, Dr. Garcia, and Coach Arnitra who are still with us. And so the question is, how do we become advocates for our own health? What's underneath that strength, that power to be able to truly be a customer when we walk into our doctor's office?
That's a great point. It goes back to what we were talking about in the last segment. Your doctor works for you, right? So, I mean, the example is like if you got a plumber that's coming over to the house and he's just taping up the pipes, right? But he's not fixing the pipe, that's a problem, you know? So if your doctor's not teaching you, if he's not spending the time, you know, to be able to explain to you, why is your A1C high? Why is your blood pressure high? What can you do? Fire him. That's what you do. You fire him and you look for other ones. And one thing I've noticed in kind of the aging community is people stay with their doctor like they're married for life. There's a lot of us out here. And the older ones, right? They got their older habits, right? So, you know, just consider others. Consider your options. There's a bunch out here.
I know oftentimes people can feel like I don't have the resources, right? For us, maybe it sounds simple sometimes to say, do this, do that, but I know for many people, it's a very real thing around financially, can I do it? Can I get to the doctor? Can I make this copay? Do I have to change this doctor? Do I have a ride? Can I get there? How do I even find a new person? But the one thing that you can do for sure is if you have a physician, make the appointment. That is step one. Actually go to the appointment, because I'll give an example. For COVID, 3 years passed and people didn't go to the doctor. 3 years. Not one, and since it's mostly women in here today, no mammograms got done, no pap smears, no colonoscopies, nothing. And all of a sudden, you're seeing the aftermath of that right there. No appointments got made. And so that is the one thing that you can do with everything, everybody in here. You can go to the doctor on time so we don't miss those pivotal moments for screening. Because oftentimes you will do everything you can, but there's still going to be that moment where something may be happening. At least you find out early. So that's the one way you can be the best advocate for yourself, is go to all scheduled appointments.
And Dr. Crawford, I'm curious about why it is so important to be open and honest with your healthcare providers, to tell them everything, instead of thinking to yourself, well, if I don't say anything, they'll never know. Yes, they will. So
Eventually,
why is it so important to be open and honest, and why is it so difficult to do it?
Well, first, we have to be open and honest with ourselves. If we're not honest that, you know what, something's going on and I need to go, because that thought is already in your head. It's been happening. It's been spinning around. So be open and honest with yourself, and be open and honest with somebody in your life so they can support you through that. But being open and honest with your care team is important, because you don't know what's connected to the other thing. Like Dr. Garcia said, diabetes and high blood pressure and all of these things are connected. And so if you're only telling one piece of the story, it's like only having one tire on a car. Where are you going? Nowhere. And you're not gonna get better. You're not gonna reach the destination of living a healthy lifestyle. It doesn't have to be this grand thing, but we need to make sure that we use our support systems, talk to the people in our lives, and make sure we can be honest with ourselves. If you want to continue to live and thrive, you have to sit down and say, well, you know what, Nicole, you really have been slacking on going to the dentist, and you know good and well there's something going on with that tooth in the back. It's been bothering you for 6 months. All right, it's time to make the appointment and go. So it's having that one-on-one conversation with ourselves.
And I mean, just from a doctor's perspective, you know, I know sometimes probably a patient comes in and they're a little embarrassed or maybe ashamed to say, listen, whatever you got going on, we've heard worse this week, right? So go ahead and tell us, because you can't fix a problem if you can't define the problem. And so, you know, you have to be upfront with your people. And by the way, you know, we're looking at the labs. We're going to see it anyway. So
it just slows down the process.
Yeah.
We're such a people of strength, and in that strength, people feel like I can just deal with it. You don't know that it actually is something. The fact that you don't go to the bathroom except once a week, you don't even know that's an issue, right? Or gosh, I have indigestion every single day. You think I'll just deal with it. Man, my stomach hurts every day. You'll just deal with it. You have to understand those are cues that there is something more going on, and you shouldn't have to just deal with it, and it's okay to tell somebody, hey, I think something's wrong.
Instead of being like men do. A lot of men, some do, men, not all men, not all men, but a lot of men are, it's got to be red, swollen, and about to fall off
Yeah.
before we will go and get some help. What kinds of questions should we be asking our healthcare provider?
You should be asking any question that you have. If you don't understand what the mean corpuscular hemoglobin is, it's okay. What's that mean? And plus, you kind of want to, give your doctor a little quiz. Do you know what that means? What's going on there, right? Ask any question that you have. We work for you.
I think you want to ask the question of, why are you leaning towards this diagnosis? What is it that it's in my information that tells you that this is the way we should go? And are there any alternatives? A lot of people don't want to take medication. Well, if they tell you the alternative is you need to get up and walk every day, get up and walk every day so you don't get on that medicine. So what are some alternatives? What else can I do? What are some things I can read? And can you give me some information to share with the people in my life?
I 100% second that. In individuals who I coach as potential clients or my own clients, the one thing that happens all the time is I went to the doctor, let's say my blood pressure was high or my cholesterol was 250, and they said I had to go on meds today. First things first, everybody, you have options and you can ask some questions, because if this is somebody who's meeting you for the first time, or let's say it's somebody who you've already had, but it's the first time you've had that type of situation come up, you can ask more questions around, can I work on it first? Now, oftentimes, a lot of physicians don't always say it because they're used to, unfortunately, non-adherence. They're used to people not doing what they needed to do, and that is the sucky part of it. But if you know that you want to make changes and you realize that, hey, this is something that they've shared today, but I have a choice in it, I can make it different, do it different. Give yourself 60 days to do it a little bit different before you jump on the meds. You don't always have to just take that. And I think that's super important for people to understand, because you can end up on 3, 4, 5 medications when you could have in 90 days changed that. So don't be afraid to ask more questions.
And don't be afraid to pester your doctor. Send the message, call the office. If you have questions that you didn't get answered in that visit, go through your patient portal, call the office, drop by the office, do whatever you have to do. We do it in other areas of our lives. We do it all the time in other areas, but we don't do it when it comes to our health. So don't be afraid to be persistent, especially when it comes to your health and well-being.
You actually are on what I was going to ask. If you had one thing that you would leave with the audience, if you would to encourage people to really elevate the focus of health and well-being in their lives, what would that be?
Your health is your wealth. We worry about our money, we worry about all the external things, but if you don't have your health, you are not going to have anything else. From the bottom of your feet to the top of your head, be concerned about your health. It's important. We cannot continue to live and thrive and pour into our communities if we are not healthy.
I would definitely say that if I could leave one piece of information, it's that no matter what your clinical picture is right now, don't think there's no way back. There is a way back to, the alternatives. What are they? They're there. And if your healthcare professional is not giving you any alternatives, find a different one. Again.
Mm-hmm. I would definitely say, if you had to just do one thing, it is, don't just talk about it, because most people realize that your health is everything. And without it, your quality of life, I tell people every day, you're robbing yourself of your quality of life. But don't just talk about it. Take action on it. Get up and move. Most people will figure out the food in some way. It doesn't have to be perfect. And especially as we get older, it doesn't have to be perfect. You're going to eat normally, fine. Get up and move. Every single day, it's going to make a huge impact on your overall health.
Dr. Crawford,
Yes.
Dr. Garcia, Coach Arnita, thank you very much for your expertise and insights today. And we hope that all of you watching this has gained something valuable from this conversation that we've truly enjoyed having with you at today's Vital Living Forum and this recognition of Black culture. We will see you next time.